Cloud. All right. Good afternoon, all who have joined us for our first data chat with the Youth and Education and Health and Wellbeing subgroup and Catalyst convening groups. And I'd like to hand it over to Rachel to talk a little bit about what the data chat is about and then do some introductions for us. So, Rachel, take it away.
Excellent. Thanks, Allison. And good afternoon, everyone. It's great to see you all. I hope everybody's summer's off to a great start. Certainly just want to welcome everyone to this data chat. The purpose of the Youth and Education and Health and Wellbeing Catalyst groups coming together is to discuss how the trends that we're seeing in the data and how they're showing up in our community. Um, this chat is bringing two of the kind of focus areas together. Again, that's youth and education, health and well-being. We've been able to convene over time, but this is a good opportunity for us to come back together. And during this particular session, we'll use the data to understand how food insecurity is affecting individuals, families, and children, and how organizations are responding so that we can explore collective solutions. So with that, I will kick us off for round robin introductions. We want to have everybody share their name and organization. The intent is to keep it brief so we can really dig into the rest of the discussion. I again am Rachel Tutwiler Fortune and here to represent the Jacksonville Public Education Fund. I will hand it off to my partner in impact, Lonnie Marks.
Hi, everyone. I am Lonnie Martz, and I am the co-founder of Level the Playing Field Leadership Academy. And I'm a data catalyst along with my my partner in crime, Rachel Tutwiler. So anyone who's up next, please have
Why,
at it.
why don't we go with Hannah?
Okay, Hannah. Hannah, you're up.
Good morning, everyone. I'm Hannah Reese. I am the project manager at Blue Zones Project Jacksonville. And I will hand off to Lacey.
Hi, I'm Lacey. I'm the research assistant here at the Nonprofit Center of Northeast Florida, and I will hand it off to Stephanie.
Hi, everyone. I am Stephanie Murray, the Director of Education at WJCT Public Media, the PBS station here. I will hand it off to, let's see, Jennifer.
Hi, I'm Jennifer Barrett. I'm Chief Development Officer at Lutheran Social Services, and I am attending on behalf of Michelle Hughes today. So I'll pass it to Coretta.
Thank you, Jennifer. Good morning or good afternoon, everybody. Coretta Hill, I'm Chief Operating Officer with United Way of Northeast Florida. And I will hand it off to Nick.
Thank you. Good afternoon, everybody. I'm Nick Fennick, the data manager here at Community and Schools, Jacksonville. I'll hand it off to Charles.
You mean me? It's Glenwood. So Glenwood Charles with Baptist Health.
Sorry about that.
No, it's okay. Everyone makes the same mistake. Glenwood Charles with Baptist Health, Community Health and Wellbeing. And I'll pass it off to Jennifer Donahue.
Oh, hi, everybody. Jennifer Donahue, also with Baptist Health Community Health and Wellbeing Department. And I'll pass it to my colleague, Alexandra.
Hi, everybody. Alexandra Reinhardt. Apologize. I'm driving to pick up a sick kid. So that's how our summer's going right now. But also Baptist Community Health and Well-Being. And I can't see who else is on the call. So if someone else can jump in for an intro, that'd be great.
I've got you, Alexandra. We'll pass it to, I think it's Brenica? Brenica Beltor? Oh, there we go. Yep.
Okay. Yes, it's Brenica Beltonor. Hello, everyone. I am the Healthy Jacksonville Collaborative Coordinator with the Florida Department of Health. And I will pass it on to the Exchange Club Family Center.
Good afternoon. Sue Watson. I'm the Executive Director at the Exchange Club Family Center, and we provide services in Duval, Nassau, Clay, and St. Johns County.
Awesome, Sue. Thank you. And I think we have Nicole just joined us. Nicole?
Hi, good afternoon. My apologies for my tardiness. My name is Nicole Ham, and I'm the Executive Director at Blue Zones Project Jacksonville. Excited to be here.
Thank you, Nicole. And did we get Sheila Jefferson?
No, no. Hello, my name is Sheila Brown Jefferson. I'm the founder and executive director of Blessing Others All the Time, vote for short.
Awesome. Thank you, Sheila, for joining us. And I think Donna just joined as well. Donna, would you like to introduce yourself? Or maybe Avery?
Hi everyone, I'm Avery. I'm the Director of Mission Impact at Waste Not Want Not.
And then maybe let's try Donna again. Donna Rex, do you want to introduce yourself? Maybe Donna's traveling as well. Oh, and one more just joined us, Gloria. Gloria McNair, do you want to introduce yourself? No. Gloria, are you connected to the audio? Would you like to introduce yourself?
Yes, I am. Hello, I'm Gloria McNair. I'm the Chief Community Officer with Groundwork Jacksonville.
Thank you, Gloria. Is there anybody else that we missed? Do I need to introduce myself? I'm Allison Owenby. I'm with the Nonprofit Center of Northeast Florida and the director of or vice president of research, um, data and strategic initiatives. Did anybody
Got Jose
else?
Acevedo. Jose
Oh,
Acevedo with the Wall County Public Schools, Director of Fund Development.
awesome, Jose. Nice to hear your voice. Anybody else that we missed? All right, wonderful. Well, thank you so much, Rachel, for that wonderful introduction round. And my job here is to kind of talk to you guys a little bit about Catalyst and review some of the data to get us grounded in the focus of the session today, which is on food insecurity. So, Lacey, I'm going to ask you to let in anybody that joins in the waiting room while I cover these couple slides. Um, so,
Allison, it's
yes, ma'am.
Donna Rex.
Oh, hey,
Sorry,
Donna.
I
No
couldn't
worries.
connect. I'm having a hard time here. Hi, everybody. I'm Donna Rex. I am leading a social justice program at Palms Presbyterian Church, and it's nice to be with y'all.
Yes. Thanks, Donna. I appreciate that.
Thanks.
Donna's also part of our beaches effort in data and has been such a wonderful partner in all of that work as well.
Thank
Okay,
you.
you're welcome. Catalyst is a collective initiative dedicated to telling the data-driven story of our region, guided by the leadership of nonprofit experts who are at the forefront of community efforts every day. And so that's kind of our tagline and definition here. And our project covers all of Northeast Florida, including the counties that you see on the screen here: Baker, Clay, Duval, Flagler, Nassau, Putnam, and St. John's. And our dashboard is divided into 6 different areas of focus, including older adults and people with disabilities, who this year has paired up with our housing and community stability group to talk about how older adults are feeling the impact of higher rents in our community, and how their limited amount of income is not necessarily keeping pace with the high rents that they're being charged within our community. Older adult population is growing within our community, as well as the share of older adults who are renting. So it's a concern for our Catalyst groups, and that's their focus area for this year. We also have cultural, civic, and social vitality as paired up with prosperity and opportunity this year. And they're really focused around the accessibility of cultural institutions and the affordability of those type of cultural institutions within our community, with special emphasis on some of the new development of parks and educational opportunities that have been developing this year. And then we have our youth and education and health and well-being cohort that's meeting today. And we're talking about food insecurity. So the we're going to review the Catalyst data walk that I emailed out before this call started, just to, again, to get us grounded in data as we begin this conversation. But just to kind of precursor that, this year, Catalyst is moving beyond sessions that inform our dashboard and moving into the space of hosting community-based conversations on data. So these data chats are one of them, our data chats listed right here. We have our data office hours that are monthly. And so all nonprofit center members are able to join and just chat about data once a month. It's really based on where the conversations are based on whoever joins, what they want to discuss, and if we can offer any guidance or help as they are building their data stories. That's the intent of those sessions. We also have a new member offering called member reports. And so those are open to all nonprofit center members. Gloria and I actually have a meeting after this at 3 o'clock today to go over her initial member report. But this is something that we're leveraging some of our tools to create custom data stories for our partners. So how can you create a similar thing like a data walk that we're going to review in a moment for your organization's mission to either tell about what the need is within our community or other types of stories you may need to tell. We have our data chats, as I said. And then last month in May, we had our first ever annual Data Day. So Data Day was an opportunity for nonprofit organizations, researchers, and local data enthusiasts to come together to talk about best practices, to learn about different projects that each other was working on, and really make connections to help organizations and researchers in our community to get better connected and to spark collaboration for future projects. We had over almost 100 people in attendance for the first ever Data Day last month, and we're really excited about the prospects there. So, without too much further ado, we're going to take out this data walk. And so the intent of this really is to just walk us through the data. So this little line you see here will guide us as we review the data. So we're talking about food insecurity, and that is an official term from the USDA. It really describes a household that lacks consistent, reliable access to enough affordable, nutritious food for an active, healthy lifestyle. It doesn't necessarily mean the person's hungry or the person's hungry all the time, but it's really about access to food, right? So it is a problem. Food insecurity is a problem throughout the United States, but the question we asked ourselves before this session is how is that affecting Duval and Clay counties specifically? So the first data point we have here is kind of the population of Duval and Clay County and how that's really changed and grown since 2013. So since that time, Duval County's population, which now is about a little bit over 1 million, has increased about 20%, 19%, and Clay County's population has increased 21%. And then we can look here that says based on the latest data, food insecurity rose in 2023 after a pandemic area low in both counties. So right now, Duval County, 14% of residents in Duval County experience food insecurity and 12% of Clay County residents. The hard numbers associated with those percentages are below.
Allison,
Mhm.
can I ask you, are you trying to project anything to us?
Yes, is it not coming through?
No, we don't. We see each other.
Oh, so sorry.
It's okay.
Is that better?
Yes, we see it.
Okay, perfect. Thank you, Rachel, for jumping in there. All right, so here we go. I'm not going to start from the top, but I'll just keep going. So this was the percentages of food insecure individuals as well as the hard numbers of people for Duval and Clay counties. And then here we see child food insecurity is a standout concern in Duval compared to Clay County and Florida overall. So here we see that 23.3% of children in Duval County, or about 52,000, are food insecure, 15.8% of children in Clay County, and 18.4% of children in Florida overall. So Duval's outpacing Florida. Then here we're talking a little bit about SNAP participation. So since 2014, the number of households receiving SNAP benefits has increased in both counties. Duval County, that went from 26,000 to a little bit over 20, almost 29,000, an increase of 8%. And in Clay, that went from 4,000 to 4,100 to 4,700, an increase of 13%. Then when we look at households receiving those SNAP benefits, we can see Duval has a larger percentage of households receiving SNAP benefits without children, while Clay's with children is higher comparatively. So the green is Clay, the light purple is Duval. And then at the bottom here, it talks a little bit about healthy food access and how that varies across counties. It just encourages folks to look at our Catalyst dashboard, scan the QR code to learn more about how that food access varies across the two counties and by census tract. So I'm gonna reopen up our data, our PowerPoint momentarily, and then I'm gonna pass it to Lonnie to introduce some of our guest speakers that will help us see how this data is showing up in our community. Can you guys see my PowerPoint now? Yes? Okay, good.
Yes.
All right, I guess I can take over. All right. So I'm going to introduce Coretta Hill, United Way. And Coretta is going to talk to us a little bit about what is United Way seeing concerning food insecurity from their 211 call center as well as full service schools. And then Avery Cesare, did I say that right, Avery? I want to make sure I
Yes,
got it
you
right.
did. Yes, you
Okay.
did. Thank you for asking.
And Waste Not, Want Not, Clay County, and Food Insecurity Task Force. And then Jennifer Barrett, Lutheran Social Services, LSS Food Pantry Trends. Again, ladies, I am thrilled to hear what you're thinking in this or what you're seeing. And I know I have a couple round robins to ask, but let's start off with what are you seeing now in our county and in obviously Clay and Duval? What are you seeing now as far as food insecurity is concerned? Should I start with
Thank you,
Coretta?
Lonnie. I can jump in here. I wasn't sure. Again, I am prepared to share information about 211. I did not know about full service schools, but I can do my best for sure. I do have some data on a slide. I don't know if this is helpful for me to share my screen or not, but I can just kind of walk through it or talk through it, whichever you prefer. And I'm okay with either.
Feel free to share your screen,
Okay.
Greta. Yeah.
Okay, let's see if this works. And I know we were in touch a couple of days ago. So are you able to see my screen?
Yes.
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 Okay. And let me just, and I will be as brief as possible. Are you seeing it still?
Yes.
Yes. Okay. So just to kind of jump in really quickly to go through what I prepared for the conversation today. And at first, I want to say great to see the others on the panel. Of course, very great partners of ours, and just had some conversations with Avery over the last week or so. And so I'm looking forward to hearing what they are sharing with you all as well. The first thing I will say is I would be remiss if I did not share, just related to all of this. Food insecurity really is the foundation of poverty in Alice. That is actually the obvious. Many of you know the foundation and the why the United Way does what we do, with 40% of our community either in poverty or Alice. And I won't go into the Alice information by age, but it was referenced the 65 and older age group, which is one of the categories that continues to increase year over year. Hot off the press soon is the new Alice report. By the way, the Alice data is always a 2-year lag. So this is 2023 data. The 2024 report is actually out, and our team is reviewing the raw data, and we actually will be sharing an update soon on what the new numbers are for 2024, and that will reflect obviously the next kind of continuation of trends and looking at where populations are going, hopefully in the positive, but we know that that's probably not the case. And then our work is around the Alice Promise, and what I'm sharing with you today falls under our Healthy Community umbrella, which of course encompasses 211, 98, and Mission United, but we'll laser focus in on 211. Full Service Schools is definitely another mental health and partnership with obviously public schools, and I'll share high level information there. And I'm happy to come back and share anything additional, or Keto can come back and share anything additional related to Full Service Schools. So just as a quick snapshot, we have, so the great thing about 211 is it is real-time data. It is data that is coming into the center right now, and we can pull today's data, to yesterday's data, last hour's data. It is information that's coming in every single day, and every hour of the day, 24 hours of the day, 24/7. And so just to give you a high level snapshot, we have to date a total of about 40,000 calls into the center. And then this is just, again, a very high level overview. You can see the majority of the zip codes that are at the top of that list just this year, fiscal year to date. And this is, when I say to date, I actually should say as of the end of May, because we wait until the end of the month, obviously, to capture that full month of data. So May 31st. And then this is Clay County, total number of callers from Clay County specifically. And you can see high level zip code, top zip codes there in Clay County, starting with 32073, and total callers from the county with a Clay County zip code specifically. And now laser focusing in on food. And I will share just a little bit. This is a snapshot literally from our internal dashboard. And so we have a ton of different categories. These are considered taxonomies, and there are hundreds of them. And so all of the food related snapshot or categories are highlighted there. And you can see Clay County had obviously a pretty, no surprise, a spike kind of during that time when SNAP benefits were an issue for our entire country. And we've had 1,300, roughly 13, a little more than almost 1,400 average calls from Clay County, with the majority of those calls seeking to find food pantries. And we even have, again, I'm sorry, I said this was Clay County. This is actually Duval. I apologize. And our top partners in Duval County, and you can see those listed, but Potter's House being our #1 partner for food support right now, in terms of referral access to information. You can see Lutheran Social Services in there and among the top as well. And you'll continue to see that most of these partners are really as a result of, first, who's in our database. And any organization can be included in our database. They just have to sign an agreement that they are willing to receive referrals from 211. And then, of course, obviously, it is still not a very known resource in the community. Not everyone knows that 211 exists, believe it or not. And so the success or the information that comes into our database is really based on two factors: common sense, people who know that it's a resource for information, and the nonprofit partners recognize the opportunity to be included in the database. Why that is a benefit for them is because we're also able to give them reports on who's calling into the center, and not only who's calling, but also which zip codes, where are people coming from who are accessing their resources as well. So it's always a really great resource for partners who are utilizing that data. And it's just something that I will say we need to leverage more as a community, but also United Way as well. So that's Duval County. A quick snapshot of Clay includes roughly 100 through this fiscal year, and then 200 resources or providers referred in that county. Again, you can see the spike during the September between October and November, and the trend of the calls coming in. I will say this call will be really interesting. I will tell you that July is always our highest peak of the year. So we are anticipating, and we actually are starting to see the trends starting to go back up a little bit in June. Typically, July is the spike for all of our calls over the summer. But that the top providers there are listed, and Clay County as well, which you'll see on another slide here shortly. And then our top zip codes I mentioned in Duval County. These are actually the top zip codes, hot top 5 regarding food specifically. That other snapshot was just kind of overall zip codes. And then I mentioned the top 5 partners. And these are, again, just based on organizations who say we have resources and they want to be included in the 211 database as a referral resource. If there are others, we would love to have them, but these are those we are aware of who are actively providing support to families. Clay County, top zip codes again, and then the top referral partners. I will say the Society of St. Vincent de Paul in Clay County has been one of our top providers for some time. Of course, you see Jewish families and Lutheran Social Services there, which I won't go into Jennifer's thunder, but we obviously continue to work with organizations who continue to share, and it's an ongoing process for our team to constantly update the database, receive information from partners. It is certainly not, it's a long, not a long process, but it's a very, I will say, kind of litigious process that requires a lot of ongoing conversations to keep our database updated. So it's not easy at all. So a lot of moving parts. And then I did want to share, I'm sure that our other partners may be sharing a little bit about this, but 211 is a state partner for the Summer Break Spot. If you're not familiar with the Summer Break Spot, it provides free meals to children at no cost, 18 years and under, while they're out of school for the summer. And there are a number of nonprofits partners, I'm sure many on this call. They operate at schools, different organizations, and individuals who call into 211 will get a connection to one of those providers. And those are specific to the Summer Break Spot program. This is a snapshot of last summer. So last summer, there were 159 sponsors, or I would say organizations, provided over 11,000 meals to hungry kids. And that was just the 2 months over the summer. It's June and July. And that just started. So that's why we're giving you last year's data. And you can see most of that was given out as public schools and private nonprofit partners. And then the last couple of things that I wanted to share is about our Ride United program. I'm not sure if some of you may or may not be familiar, but through United Way, we have a partnership with Lyft, not Uber. So the Lyft program, and it provides free transportation to individuals in need, in particular for basic needs support. The 3 main reasons, and it has to be for an urgent or critical basic needs support. It cannot be a ride to their girlfriend's house. So it has to be something like food, picking up food and groceries from a pantry or a grocery store. It could be a ride to work. So to get to, my car won't start, I can't get to work. So that it will help a person get to their job for a one-time need there. And then, of course, the other is any rides related to health appointments. So non-emergency appointments. So a lot of our seniors use that service to get to their health appointments to when there's lack of transportation resources or inability to drive. So just through this, starting in January, I only gave you a very small snapshot here. Our rides total have been over 67,000. I actually should have totaled up the number of rides as well, but you can see we've provided thousands of rides to individuals and the rides for food has increased. And that was the point that I wanted to make, is that we're starting to see more individuals requesting rides to get to a pantry or to a grocery store. And a good number of those are seniors. I didn't have time to get that granular in the data, but I can certainly share that at a later time. But that was the team wanted me to share, is that they are seeing more individuals needing a ride to get to food. And so for that reason, they've actually prioritized that. And so individuals calling for any other reason, they're trying to prioritize the food access first, along with rides to a health appointment. So that is, I'll just stop there. I will share with you all that our dashboard is pretty intuitive, and I can at a later date share. It is an internal dashboard, but it has a ton of information from not just zip code, but also gender and race. So we can break down callers by gender, by race, by zip code. We also track unmet needs. So I didn't share this in my presentation today, but we do have quite a few thousands of other calls where their needs did not get met because we didn't have a referral for them. And we track that as well because it's important for us to know who we're not able to serve or provide a referral to, so that we can hopefully close that gap. And that's part of our goal. So it's a pretty robust system, but it is because they track everything from the beginning of the phone call to all the way to the end of the note taking within our database. That's a pretty quick, hopefully high level data update. Is there anything else or any questions for me?
I have one.
Yes.
Hey, hi, Coretta.
Hi.
I was just curious about so the zip codes you mentioned all make a lot of sense. I was just wondering what, if anything, you guys are seeing in 32206.
06. So I can tell you, yes, 06 is within the top 10. Yeah, I'm looking at the dashboard now, and it's within the top 10. I would say 09, 10, 18, 44, 08, and then 06 is right after that. Mhm. Great question. Did someone else have a question? I thought I saw another. Well, hopefully that was helpful, and I will let you continue on with the rest of my colleagues. I know they're on the ground doing the work, so I'm looking forward to hearing from them too.
Thank you, Coretta.
Of course.
We will move right to Avery. Avery, do you mind sharing what you have as well?
Sure. Thank you, Coretta. That was great insights. Would you like me to share my screen? I know we might be tight on time, and I prepared to also not share slides.
I would say
Okay on time?
we are running a little bit long, but Avery, feel free to share I think it's important, the work you're doing, so please.
Yeah, it's a map, so it's a bit easier that way. Okay. But I'll try to kind of skip through it. Okay, does everybody see? Yes? Okay. Hi, I'm Avery. I'm the Director of Mission Impact at Waste Not, Want Not. So what we do, we're a food rescue nonprofit based in Orange Park in Clay County. And we rescue surplus food from donors like grocery stores and restaurants, and we get it to our food distribution partners. So they're hunger relief organizations across Northeast Florida, not only Clay County. But I wanted to introduce today our Clay County Food Insecurity Task Force. So last summer, summer 2025, Waste Not Want Not convened a task force in Clay County. And as we saw before, we have a food insecurity rate of 12%. And each year it continues to increase. And we distribute a lot of food to organizations just within Clay County. And we wanted to, make sure that we're really moving the needle on food insecurity there and not just moving food around. So we brought together the Clay County Food Insecurity Task Force with various people from different sectors, so the health, education, different food pantries, different nonprofits, to come together and tackle more, as a task force, more people at the table, a bigger conversation, and coordinated strategy. So data, why we're all here. So we want our coordination to be rooted in data, and we started with this map right here on the left, which is to showcase, where is the food insecurity specifically in Clay County. So I know it's a bit small, but the darker areas is where there's more high food insecurity. So, as you can see, it's quite pocketed. And it's, in the northeast corridor, it's west, it's south. And then the diagonal lines, I know it's hard to see, we layered on top of it USDA designated food deserts to see, if that overlaps. And it was interesting to see that, it overlaps, but it's not as dark as some of the other areas. And then on the right, we have put together just waste not, want not distribution partners on top of there to sort of see, where is the food insecurity, and then where are the resources. So as you can see, in the northeast corridor is where the saturation is. And that was something that, we think is important to pay attention to. It is true that there's high food insecurity there, so that's great, that there's lots of resources there. However, what about these other areas? What about Keystone Heights and Middleburg and Green Cove Springs? So looking at these maps now, we want to sort of pivot our strategies. So, before Waste Not Want Not was taking on first come, first serve food partners, but now we're, going to, look at maps and prioritize these pocketed gaps, these areas where we need to see more resources. And then the next one we have is a SNAP access gap. So we also mapped SNAP retailers against the SNAP recipients. So it's a similar picture. So the people who, it's good that they're SNAP recipients. So as you can see here, it's very dark, and there's more resources, more SNAP retailers as well, in a similar pattern in the Northeast region, which we think, is important to highlight. So again, these pockets need to be sort of filled, and we want to prioritize strategies where we bring more partners on in these areas where the need is high. And then something else that I don't have in this presentation as well is we did a cross analysis of a distribution of timing. So our distribution partners and their timing. So when are the food pantries happening? Where are they happening? And what days? So again, of course, it highlights that they're in Orange Park, they're in the Northeast Corridor, but also something that we noticed is that they're all happening at a similar time. So between 10 a.m. and noon seems to be a really popular time for food partners to be distributing. And as Coretta was talking about the Alice population, that's a window that is directly excluding a huge working population. So people who need food assistance but are at work during those hours simply, can't get to the food pantries. So prioritizing as well, distribution hours, or partners that want to distribute at, 5 p.m., 5 to 6, or on days where there's less. So we've been mapping out where, when, what days, and we're going to use that to fill in the gaps and hopefully reduce food insecurity. And one thing that I did want to bring to everybody's attention is that CFIT, the Clay County Food Insecurity Task Force, is launching more publicly on June 25th from 11 a.m. to 2 p.m. at the Clay County Hunger and Food Access Summit at Baptist Medical Center Clay Auditorium. So if you want to join in on this conversation, we really encourage you, or you can also email me if you want to get involved. And those are my data sources, but I'll be quick because I know we have another presentation.
Thank you, Avery. Does anyone have any questions for Avery? No questions? Well, Avery, thank you.
Thank you.
Absolutely awesome job. I mean, our youth and the time frame, we need to get this done. Excellent. That's excellent. Thank you. I will turn it over to Jennifer Barrett of Lutheran Social Services. Jennifer, we're looking forward to hearing what you have.
Yeah, thank you so much. And I can actually make mine pretty quick. For those of you who don't know, we do have a pantry on site at Lutheran Social Services. It's open 5 days a week. And so, I mean, I was just looking at the average numbers for this year. On average, we've been serving almost 1,800 unduplicated households per month. But we are seeing, every year we see the summer hunger gap, when school's out, a lot of families lose their access to free meals. And yesterday, our pantry manager reported that just for the first week of June, the first 7 days, we served 700 families. So we're definitely seeing that summer hunger in full force. We have made a lot of efforts this year to try to expand access to food through our pantry. So we have increased the hours. I think at the beginning of the year, before this year, it was 10 to 12, 5 days a week. And then, like Avery said, we wanted to try to create more access. So now it's 9 to 2, Monday through Friday. And we're also doing Saturdays once a month. We kind of started the Saturday as a pilot. And we expected more people than we've seen. So I don't know if we'll be doing other Saturdays, but for now we are doing one Saturday a month. We also, with a very generous grant from Baptist Health, we started doing mobile pantries this year, and that was kind of born out of some very specific needs we saw with our refugee services program. Like a lot of our, refugees lost their SNAP benefits, and it was at the same time that they were even our refugees who are they're here completely legally, still afraid to leave their homes and neighborhoods. So that was kind of what started our mobile pantries, which are open to anybody, but we did kind of locate them in areas that are either in or near food deserts with large populations of our refugees living there. And that's been really, really amazing. We've been able to also take culturally specific foods, for example, so like maybe halal meat, different types of flours and grains that the different populations um, are used to. We've tried to increase, even at our regular pantry, the amount of food folks are getting. So it used to be 30 to 35 pounds. Now it's closer to 40 pounds. I will say food donations are not similarly increased. So we have been purchasing more food with grant dollars. And we've seen such a need also for diapers, baby products, and pet food. So we've been trying to make those available at all times also. I feel like I kind of rushed through it just because I know we're in a time crunch, but that's kind of in a nutshell what we've been seeing and what we've been trying to do to increase access.
Jennifer, that's great. That is great. That's great news. Obviously, the hours increasing so that you can get more access to everyone is huge. I know when you're doing this work and you want to be obviously faithful in what you're doing, you want to make sure you're doing the impact, and that is great. I appreciate that so much. Does anyone have any questions for Jennifer?
Hi, I put a question in the chat. I wanted to know where is the address for the on-site food pantry so that I can share it with the other departments here at the health department.
Yes, I will put it right there in the chat.
Thank you, and thank you for the awesome work Lutheran Services is doing for our community.
Yeah, thank you so much.
Okay, should I turn it over to Ms. Nicole Ham? All right. Ms. Ham, you are up.
Thank you so much, Lonnie. Good to see you, my friend.
Good to see you.
So I know that we were originally going to try to do some smaller group discussions, but man, what an incredible panel with a lot of incredible information. And so considering we have these people in the room, I'd love to open up the discussion for our full attendees here today. And I know we've got, and Allison, keep me honest, about 13, 15 minutes before we need to close. But I'd love to just open it up. We have some guiding questions, but if there's any initial thoughts or anything that has bubbled up of what we've heard over our past three panelists, and even some of the data and service chairs of the Catalyst program, I'd love to start there. And then, of course, we have some of our leading questions, if you'd want to take a stab at answering any one of those. So I'll take a pause and give us about 30 seconds to get our thoughts together. And then I'd love for someone to take the wheel and open up our conversation for dialogue.
Hello.
Hi.
Hey, so this is Sheila Jefferson. My nonprofit is BOAT. So we don't get funding for food, but I've been getting, evidently my name is listed. Well, I'm on 211, not 211, findhelp.org, and also Hope Fund. So they've been sending people were calling me, or and they also put it in the Find Help database. So they've been needing groceries. So like this week, I know I had about 10 calls for grocery. And because we don't have a building per se, so what I do when we have funding, I order grocery from Walmart and send it to those families, but they have to fill out an intake form so I can see what really the needs are. But I know this week I had at least 10 calls and I was able to serve like 3 families. So I know none of that's not captured, but I'm gonna get with Coretta though. I really don't want to be added to 211, even though I really do, but because we don't have funding yet, but I will be able to help some people. So that's one based on number 2. So I just
Yeah,
want to
no,
share.
that's so great. And are you seeing anything in particular? Like, is it more produce? Is it more dry goods? Like, do you have any
Everything,
indication? Everything. Yeah.
yeah. So I just kind of
Mhm.
like do a little basic stuff like milk, bread, some chicken, fruit, yeah. And some of them may
Sure.
have needs. Like I think one man a couple weeks ago, he was diabetic, so he told me exactly what he wanted, like a lot of protein stuff. So
Hmm.
like I said, we don't get grant funding for that, but from our fundraiser, I do try to help families during the year.
Yeah, well, Miss Sheila, I'd love to. Hannah Reese is on this call. We actually have a community garden that we continuously harvest fresh produce from.
Mhm.
It's small, so I can't
Right.
Lutheran Social Sorry, I can't give you 25 pounds, but we do have little things that might be good additions to ensure that
Mhm.
there's healthy options within some of the things that you're ordering. So, Hannah, if you wouldn't mind maybe getting Miss Sheila's information, just knowing you're a little bit of a smaller entity and so was Blue as
Okay,
those, maybe
I'll
we
put
can
it in
work
the chat.
together. Yeah,
Thank you.
of course. What else has shown up from our panel and in our meeting today in general?
Well, Nicole, I'll just say it's been really good to hear about the data and the trends from every zip code and all of the partners who are doing this great work. What is top of mind for me is how so many of these resources, there just needs to be broader awareness in our community so that people who are navigating food insecurity can effectively tap into them. I'm thinking in particular about, for example, the Lyft partnership that United Way has. And I think finding ways to really broaden awareness of those resources would be a good opportunity.
Yeah, I completely agree. I made a note. I sit on one of the transformation committees with Lynn Sherman at the city, and this continues to bubble up. Is there a general map, right? This kind of master list of food security resources. So I'm really excited to bring this back to her. And I know Allison's been taking notes of what we've experienced today and how maybe that's a core effort that we can all get behind and maybe build out.
Yeah, I
Coretta,
was.
I see your hand. Oh,
Oh,
sorry, Lonnie, go ahead.
no, you're good. I'm definitely let Coretta talk. But I was going to say, I agree with you, Nicole. This is something that Mrs. Sherman is definitely interested in, and it's going to look good bringing this back because knowing all the resources that they have on this call, that's going to help obviously fund and feed. So go ahead, Coretta.
I was going to share that is of course I'm on that committee too with you, Nicole, and that conversation has been happening for a long time. I will say that is one of the challenges that is going to require Um, it's going to require intentional collaboration and coordination, and I think the there what I will just say, it doesn't it helps when we're not operating independently, and that is there's a group of a network that are I think are really collaborative and just being transparent. Sometimes it's hard to move the needle in this space because of trying to help move others along who are more independent, and understandably why. However, because there's so many resources, as you probably saw, there are churches that are in our database and nonprofit partners, and there are probably dozens who are not in our database who should be. Um, and so if there are multiple databases all over the place, right? How do you get all of that information in a central location? And that is actually the point. That was a reason, and certainly whether it's 211 or someone else, but whomever is owning or kind of has that footprint, and the infrastructure already built, is the question of how do we get everybody on board and on the same page of understanding the value of having a centralized resource, of information, because it's there. We just all have to kind of get on the same page, and corralling everyone is definitely not easy. I think I'm speaking to the choir here, but I will say that is a challenge that we have to solve. Kind of like the literacy challenge, right? How do we all get on the same page about this issue so that we're able to see the needle move?
Yeah, absolutely. Allison, I know we have maybe about 2 minutes left before we need to close out. I just want to express gratitude to all of you, taking the time to be in this space, and then also express gratitude for actually doing the work in this space. I echo you, Coretta. This is hard work and it's heart work, right? Showing up and being present for our community. But we get there with a little help. What does the Beatles say? You get by with a little help from your friends. So I think one nonprofit center, thank you for holding the space for us to get together. And I'd love if we just all could commit to a call of action of following up with our stakeholders and team members about what we've experienced here today, whether that's sharing slides or sharing the recording, and continuing to corral and be on the same sheet of music so that we can better support and serve our community, ensure that everyone everywhere has an option and the availability to have a better quality of life. Thank you.
Beautifully said, Nicole. All right, I'm going to wrap us up here, guys. We've got a couple minutes left, and I just have to take a moment to plug some of our upcoming nonprofit center events. Tomorrow is Catalyst Office Hours, so if you're feeling inspired by today's conversation and you want to tell your own story with data, please join me tomorrow. I have an hour session where I just hang out and whoever joins, and we just have a really good, robust conversation. I do try to connect you with the data sources or stories that you may need to tell your story. Next week on Monday is another one of our Catalyst Connect Clay sessions. So we have a series of meetings coming up in Clay where we're going to work with nonprofit organizations in Clay County to document how they're measuring success. So instead of just informing our dashboard like the regional sessions we had last year, we're going to work with the organizations to document how they're measuring success, what data that they're collecting, to then kind of build some best practice guides that we can share among organizations who are doing like and similar work. So those sessions kicked off on June 1st and will be hosted over the summer and into the fall. We have Sector Connect Office Olympics also coming up on June 17th. And so I would love to see the folks on this call sign up for a team so you can set up your own organization as a team, compete against other teams. I know we've got lots of representation already from, I think it's Leadership Jacksonville has a big group signed up, as well as Literacy Alliance. So we'll see who will be crowned king or queen of the Office Olympics. So think about Dwight and Michael and your favorite Office TV show. So there'll be some fun and silly games that we'll be playing. Our Essentials series on succession planning will also be in June. We've got a session about board roles and responsibilities in July. And then we have some sustained collaboration clinics exploring partnerships and mergers July 21st and September 22nd. And this wouldn't be a data event if I didn't ask you for your feedback. So please, if you have a few extra minutes after this, scan our QR code and let us know what you thought of the session and how we can make it better for the next round. But thank you for spending an hour of your Wednesday with us and with me specifically and our wonderful Catalyst chairs. And I hope that I will see you again very, very soon. Thank you so much for joining us, guys. Have a great rest of your
Allison,
day. Yes, ma'am.
Allison, someone asked if you could put the link to the survey in the chat as well.
I will. Yes, let me stop
Thank you.
sharing so I can grab that. There is the link, and I will see you all soon. Have a great rest of your Wednesday.
Thanks,
Thank
Allison.
you.
Thank you. Bye-bye.